السلام عليكم ورحمة الله، ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك. Review of Prometric Test Question. This is lecture number 2 in Thyroidectomy and number 12 in Ghaith review. Today we are going to discuss 5 questions from question number 83 up to question number 87. معكم محمد عثمان هي. نبدأ مباشرة. Question number 83. The nurse should observe for a treacherous sign in the client with which of the following electrolyte abnormalities. The options are number A, hypocalcemia, number B, hyponatremia, number C, hypochloremia, number D, hypocalcemia. وقف الفيديو هنا واختار الخيارات بشوف صحيح. The correct option is option number D, hypocalcemia. ليه اخترنا الخيار رقم D؟ نشوف rational. Treacherous sign is a carpal spasm induced by inflating a blood pressure cuff above the systolic pressure for a few minutes to determine if an individual may have hypocalcemia or not. Treacherous signs is considered positive when carpopedial spasm of the hand and wrist occur, like this, after an individual wears a blood pressure cuff inflated over their systolic blood pressure for 2 to 3 minutes. So the correct option is option number D, which is hypocalcemia. Question number 84. Stimulations of the facial nerve via the master muscles causes twisting of the nose, lips in hypocalcemia is known as. The options are number A, treacherous sign, number B, chauvinistic sign, number C, Homan sign, number D, Ghaith sign. وقف الفيديو هنا واختار الخيار بشوف صحيح. The correct option is option number B, chauvinistic sign. اللي اخترنا الخيار رقم B نشوف rational. Chauvinistic sign is a spasm of the facial muscle caused by tapping the facial nerve just anterior to the ear. So the correct option is option number B, chauvinistic sign. Homan signs or dorsiflexion sign is considered by some physicians to be a sign of deep vein thrombosis, DVT. Ghaith sign is an indication of pregnancy. It is a significant softening of the vaginal portion of the cervix from the increased vascularization. And treacherous sign is a carpal spasm can be elicited by compressing the brachial artery with a blood pressure cuff for 3 minutes. So the correct option is option number B, chauvinistic sign. Question number 85. Patient is being admitted to the recovery room following a thyroidectomy. The wound is covered with dressing. During the first 15 minutes, the patient started working and having diarrhea. A general assessment is performed with special attention given for the high risk for hemorrhage. Where will bleeding most likely occur? The options are number A, stool, number B, vomitus, number C, dressing, number D, back of neck. وقف الفيديو هنا واختار الخيار بالشيء الصحيح. The correct option is option number D, back of the neck. اللي اخترنا الخيار رقم D نشوف rational. Lots of blood flows through the thyroid gland, and bleeding is a potentially life-threatening complication after thyroidectomy. Because the patient is on semi-fowler position post-operative, the bleeding will take its way by gravity to the back of the patient's neck and shoulder. Therefore, the nurse should monitor the wound dressing specifically behind the patient's neck to make sure blood is not pooling behind them. So the correct option is option number D, back of neck. Question number 86. A 29-year-old man is in the surgical ward on his first post-operative thyroidectomy. He appears drowsy, but he is able to respiration by nodding head. He is developing mild restlessness. What is the initial recommended goal of care? The options are number A, monitor vital signs of thyroid storm. Number B, assess for bilateral vocal fold mobility. Number C, monitor for swelling on the neck. Number D, monitor for vocal cord paralysis. وقف الجديد اختار الخيار بالشوف صحيح. The correct option is option number A, monitor vital signs of thyroid storm. اللي اخترنا الخيار رقم A نشوف rational. Thyroid storm is a life-threatening health condition that is associated with untreated or undertreated hyperthyroidism. It can be caused by manipulation of thyroid gland during surgery and the release of thyroid hormone into the bloodstream. It also can occur from severe infection and stress. During thyroid storm, an individual's heart rate, blood pressure, and body temperature can climb to dangerously high levels. So the correct option is option number A. The nurse should monitor vital signs to confirm that if the patient on a thyroid storm or not. Question number 87. A nuclear plant experienced a leakage and all involved workers were brought to the emergency department for treatment. The medical team prescribed potassium iodide for the workers to block radioactive iodine to be absorbed by an organ in the body. Which of the following organs is the most sensitive to the radioactive iodine? The options are number A, brain, number B, lungs, number C, kidney, number D, thyroid. وقف الفيديو هنا اختار الخيار بالشيء الصحيح. The correct option is option number D, thyroid. اللي اخترنا الخيار رقم 2 نشوف rational. Ki or potassium iodide is a salt of stable, not radioactive iodine that can help block radioactive iodine from being absorbed by the thyroid gland, thus protecting this gland from radiation injury. The thyroid gland is the part of the body that is most sensitive to radioactive iodine. So the correct option is option number D, thyroid. شكرا جزيلا. نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe. مع السلامة.